Hi, I'm Elisa. We're back. We're doing the respiratory system, and this time we're going to go talk about the nose a little bit. So let's talk about the anatomy of the nasal region. This is the exterior anatomy. So this is known as the root of the nose, right up here. And then if you remember, you actually have a couple of like nasal bones, right, that are going to kind of clip in, and then we're going to have cartilage in the rest of this area. So this is known as the bridge of the nose. The dorsum nasi, right, is like dorsal fin, right? Think of it like a fish, and they have a dorsal fin, right? So that's the dorsal point. Nasofacial angle is going to be that sloping area that your glasses are going to kind of sit on, just a little bit down from that. The apex of the nose is the tip of your nose. Let's see here, ala nisi are going to be these like kind of bridge portions of the nose itself. Nares is the nasal, right? So Latin. Nasal septum is that which divides the nose right in here. So it separates it, maybe is how you would want to think about it. The philtrum is these little, like, it's actually the mouth and the nose are connected, like biologically, for a long time. And then they separate out as we mature. It's like a cleft palate is one of the last things to open. And so this is kind of an artifact of that final extension and then closure. Alar nasal sulcus itself is going to be this like little kind of ridging right here on the external point of the nose. Okay. So this is the cartilage and bones itself. So again, here are those nasal bones up here. And so our nose tends to protrude out just like a tiny bit, like it's actually really, really, really tiny. It was a little bit more so back when we had more of a prognathism, but that has since changed. So right here are lateral cartilage bases. So some people will have more extended, like more of a bump kind of coming from here. It still has a septum up at the top. Oops, sorry, go back. The septal nasal cartilage, hold on, let me erase that stuff. There's like a lot of it. Okay, there it is. Okay. Is going to be kind of coming down that center point. Okay, so down behind, in dividing both of the lateral cartilages, right? So it'd be like, here's lateral cartilage, and then this would be where the septal nasal cartilage is going to be. The alar minor cartilages are going to be kind of like down here. There's just a couple of extras down here, but the major ones, alar, meaning up and aloft, are up here, making kind of like the bowl of the nose at the apex. And then down here, we have actually just dense connective tissues, which are going to allow it to be like a very flexible region of the nose, right? So you can flare your nostrils, for example. That's always fun. Okay. The nasal fossae, or coming from the term fossa, are the right and left halves of the nasal cavity specifically, and that is divided by the nasal septum, right? Because it separates them. It's composed of bone and hyaline cartilage. Vomer, if you remember when we were talking about like the bones of the skull, the vomer is tiny, tiny, and forms the inferior part of that, but connects into the ethmoid bone at the perpendicular plate. The septal cartilage is going to be forming the anterior part, or the part that's like out the most, right, out in front. Okay, so here's this part. The roof and floor of the nasal cavity. So remember all those bones on the inside of the skull that were so difficult to conceptualize. So remember ethmoid specifically had a lot of the sinus ridges in it. Yeah, very, very fragile bone. And then the sphenoid bone actually separates, like here's like sella turcica, the Turkish seat, and here's the sphenoid bone inside the skull, right? And then like the frontal lobe is going to sit right there. Okay, and then right here would be, where the face is, and then the nose in this region. The hard palate is going to form the floor of the nose itself, also connecting into and forming the roof surface of the mouth, right? Remember, because those structures were connected, especially during development, they actually separate out. And that's what finally physically separates out the nasal cavity from the oral cavities. Really, they like to be connected. They wanted to be, uh, and now they're not. So this is what allows you to breathe while you chew food, right? Which is handy. It would be difficult otherwise. The perinasal sinuses and the nasal lacrimal duct also drain into the nasal cavity. So if you remember nasal lacrimal, like here's the eyes, right? And there's a little like tear duct, and they'll drain right into the nose, which is why when you cry, you get a runny nose as well. Okay, the vestibule is at the beginning of the nasal cavity, hence as wide as the vestibule. It's a small dilated chamber just inside the nostrils, like just inside, like if here's the apex, right, of the nose itself, right? So this is like vestibular region right in here. It's lined with a stratified squamous epithelium, and the reason is because we are going to be shedding a lot. Every time you sneeze or every time you breathe, this is kind of rubbing and rolling against that area itself. Vibrissae is stiff hairs actually that are blocking, hopefully not too many insects are trying to get in there, but they do what they do. But mainly things like stuff that's floating, pollen, right? Stuff like that from entering the nose, where if it gets in there, it can get really, causing allergies, causing infections, especially bacteria, fungi, all that good stuff. Okay. Um, Posteriorly, the nasal cavity expands into a large chamber. It has less open space, and it's going to eventually lead into the pharynx as well. Um, right. Okay, so the chamber behind the vestibule is occupied by some folded tissue, right? And this folded tissue can often become inflamed, often become the site of the nasal infections, right? And we refer to this as the nasal concha, right? So this is usually right off, obviously, the ethmoid bone. So what it does is like as air, okay, so here's like nose, right? And then here's like those folds is like the inside of the nose. So as air like comes into the nose, it kind of like does this, right? It becomes turbulent through the nasal concha. And it does a couple of things. Number one, it like makes sure that it gets like, through all this olfactory and sensory area. It knocks out a lot of like maybe pollen or bacteria that would be and like remaining in those areas, which again is why we might get allergies. You might get bacterial infections, stuff like that. Mainly it's because we're wanting to collect that stuff in the nice sticky doopy oopy mucus membrane, and that's going to help clean out that debris before we bring all that air fully into the respiratory system. It also creates like it warms it up, right? It warms it up so we don't have like a tissue level shock, and that mucus also allows for moisture in the air. Okay, all right. So the nasal mucosa has a respiratory epithelium, so that layer is going to be um, primary for the mucosa to kind of be developed and rest. It's created by pseudostratified columnar epithelium. Right? It's basically goblet cells, right? They're all really long and they're kind of like this, and they have these big like balls of mucus that they're manufacturing and then like pushing out to the surface, right? And that's how that's produced. It also has cilia, right? And so some of that cilia like kind of directionally moves things like mucus, things like trapped particulates along as well. So the cilia are motile, meaning they are moving, and they again are propelling that mucus towards the pharynx. So most of the mucus that you are making, you actually swallow a lot of it, and then you digest it and you eat it essentially, then that gross. But it's also, better than it going into your lungs, right? Your digestive tract is pretty harsh and can shut down a lot of these invaders pretty quick. Okay, so the olfactory epithelium, sensory is what I want you to be thinking of because of the olfaction, right? So that's what I want you to be thinking of. It's detecting odors through sensory means. The cilia aren't ones that are moving around. They're actually like kind of like standing still. And what they do is they reach out and they're kind of like trying to feel and bind with molecules to determine if it's like an odor or a smell. It's a chemosensor, right? It senses chemicals, and it only covers a small area of the roof of the nasal fossa in humans, and so we can't smell super good, which might be good because apparently, we humans are pretty stinky as far as animals go. But other animals, wow, they have a lot of that. Okay, We also have erectile tissue because it means is when blood fills that tissue in the nose, especially in the nasal concha, it like becomes inflamed and red and full, and it's like it swells it up, and that becomes um, kind of it's weird because if you've ever only been able to smell it out of one side of your nose at a time, that's not atypical terribly. They say every like half hour to hour, the tissue on one side is actually going to swell up with blood, like so much that you feel like you can't breathe out of it. Let's just like take a minute, take a take a breather, right? And just see if you can smell out of which side of your nose. All right, lefty is definitely open for me right now. I'll try that in a little while if I remember. I'll see if righty opens up. I guess it'll be a few videos from now. Anyway, so it restricts airflow through that fossa. So we have like the singular direction, which is kind of funny. So, and what that does is it just allows for like some repair, some tissue repair, so it doesn't become chapped and all that other stuff. And so what happens next is the preponderant flow of air shifts between the left and the right nostrils once or twice an hour. So just like you shouldn't really be able to breathe out of both sides of your nose at the same time. So like don't just cram Afrin up there if you're not, if when you got one shut down, especially even if you have a cold, like just let it kind of go back and forth, right? Okay, so I think that's pretty good for now. I just wanted to really quick just kind of go through this. So here's that concha we were talking about causing all that turbulence, swelling on one side and the other. Here's the pharynx back here. Guard hairs are going to be up in this area. And here's the vestibule just out in the front. Nereus the nostril. Here's that hard palate that forms and separates the mouth from the nose now that it wants to do that. Anytime you see the word sinus, just think of like this open like lobby of space inside of a structure, right? So that's what that means. Superior, middle, and inferior nasal concha just means are those are really high up, or is it in the middle, or is it lower, right? So that's what that is. Meatuses. A meatus is like a tube or like a hallway for something to go through. So that would be what these are. So these are the meatus of like the concha, for example. Here's that sphenoid bone back here, frontal bone, right? So here's the nasal bones. Ethmoid would be like all in here. Okay, so I'm going to let that be that. And right, we will see you very soon, hopefully in the next video. Okay, bye-bye.